Students who are in the Arrowsmith program see changes at a variety of time periods. The most common is in 3 months of active engagement in the cognitive exercises, but that needs to be qualified. I know that there are cases of severe dyslexia that come to Eaton Arrowsmith School, and these severe cases are students who've had programs like Orton-Gillingham, Reading Recovery, and they may have had these programs of intervention for 3, 4, 5 years, and there seems to be minimal progress in that these intervention programs are implemented with the utmost integrity, but they just don't seem to be moving quickly. These students' reading levels don't seem to be rising, and spelling is still very difficult for them. When we do the Arrowsmith assessment, we often find that of, let's say, 6 areas of the brain involved in reading, 4 or 5 of them will be in the severe range of dysfunction, meaning it's a severe case of dyslexia. In those situations, it could take up to 2, maybe even 3 years of cognitive intervention before we actually see reading, writing, and spelling improvements. And this can be tough for families and students who have severe dyslexia because they like to see faster progress. But because of the severity and the multiple cognitive dysfunctions, it just does take longer. The brain needs these cognitive functions in order to absorb reading skills and writing skills and spelling skills. However, there are these cases, and the majority of the students actually feel this way, that in 3 months they begin to see improvements. And a lot of this has to do with executive functioning ability. Because of the nature of these programs that require active engagement, lots of focus, we see improvements in prefrontal or executive functioning. So these students can focus for longer periods of time in their academic classrooms, math or English. They can follow conversations at home without losing track because their executive functioning systems are in place. So it's exciting to see things that happen quickly. And it can be frustrating for those cognitive functions that take longer, especially severe cases of dyslexia, for example.